The overarching story is that she's a young girl who was taken by Johns Hopkins All Children's Hospital against her will. She was suffering from complex regional pain syndrome, CRPS, and she was initially receiving ketamine infusion therapy for her condition. However, when she was brought into the hospital, the situation escalated due to a misunderstanding of her condition and the treatment needed. She was held at the hospital away from her parents for an extended period of time for concerns of Munchausen by proxy. So we are going to dive in today to a lot of the father's testimony. So the father's testimony has been spread out amongst a couple days. So we're going to start with this portion of the father's testimony and see his experience losing his daughter for a period of time and his wife.
Remember, you're talking to them. Please state your name for the record.
Jack Kowalski.
And where do you live, Mr. Kowalski?
I live in Venice, Florida, community called Stonewalk.
And who was your wife?
Beata Kowalski.
And who are your children?
I have 3 children. My oldest is Corinne Franz. She lives in Wisconsin. Maya Kowalski and my son Kyle Kowalski.
And how old are you?
How old am I?
Yes.
62.
So when the events of 2016 went down, you would have been, what, approximately 55?
Somewhere in that area, yes.
Tell us a little bit about your background. Where were you born?
I was born in Elmhurst, Illinois. It's a western suburb of Chicago.
Mm-hmm. And what'd your dad do?
My dad, he repaired air conditioners, Fedder's air conditioning, I believe. Then he moved here, and he was a boat captain in Tarpon Springs.
All right. And you go to high school up there?
I went to high school in Northlake, Illinois. It was called West Leyden High School.
And any college or any training after that?
Well, I started out in high school. They had a fire cadet program where I would go to the firehouse in my senior year. It'd be in the afternoon hours, Monday through Friday. And what we were able to do was learn the firefighting through the state of Illinois certificates. Ended up getting a firefighter state certified 2.
What's a 2?
It's the highest level at that point that I could have took.
So how old were you when you got that?
18, 19, somewhere in that area.
So when did was there any more training after that?
While I was still in high school, I was allowed, as long as my grades were good, I was able to go to Triton College for EMT. That's the basic.
Okay. And so were you licensed or certified in that?
I was licensed, I don't know if they call it licensed or certified, but yes, I was.
So your medical knowledge there, you had some through the remainder of your life from this?
That was the beginning, and then I ended up in 1986, I was certified paramedic.
And so, but between you and Beata, who had more of the medical knowledge?
She did, by far.
All right. Okay. And so tell us a little bit about your career in the fire department. You came on as a cadet.
Yeah, once I was a cadet, I ended up, I was fortunate enough to become a fire dispatcher while I was still in high school. I would dispatch for that fire department, North Lake Fire Protection District. I would stay overnight. School bus picked me up, take me to school the next day. Made about $60 a day, which seemed like a ton of money at the time, but it was a great opportunity.
And did you stay in firefighting?
I stayed with Northlake until 1985, and I moved out to Phoenix, Arizona for a short period of time to help my sister with her landscape business. But while I was out there, I ended up going into it was like a cadet program through Phoenix Fire Department.
Got it. And so when you came back, what year would that have been to restart it in Chicago?
That would have been 1986. I received a letter while I was in Phoenix, Arizona, that I was accepted into the paramedic program at Loyola University Medical Center.
And so what was the next fire department that you worked for?
Almost as soon as I graduated paramedic school, I was very blessed. I ended up getting hired by Broadview Fire Department.
And did you stay with Broadview for very long?
For my whole career, 28 and a half years.
And what position did you start in?
Started out as a firefighter paramedic. We rotated. We had a 12-man shift. We were in a community. It's about 2.2 square miles. Don't sound like much, but there was a lot within that area. And then we also belonged to, it's called Division 20. It's about 16 other fire departments that we worked with. So it was a very large area, anywhere in between Midway Airport and O'Hare Airport.
So this was a suburb of Chicago,
That is correct.
a fairly populated area.
Very.
All right. And so as I don't want to call you a junior firefighter, but at that level of firefighting, what types of things did you have to know and do?
At our department, we rotated. So one day you're on the ambulance, next day you might be on the heavy duty rescue squad, ladder truck, or the engine. So you had to be certified in everything, which was nice.
To see any fires?
A lot.
All right. And during that, I guess, what did you have a specific task there that you were tasked to, either the hose or the ladder or anything like that?
No, like I said, we rotated, but in addition to that, there's specialty teams. There's a photo unit that I belong to, technical rescue. That's anything from confined space to high angle, going off a water tower, below grade, things like that. And I was also on the hazardous materials team for the division.
Now, in addition to the firefighting, did you also have some certificates from FEMA? If you explain what those are.
Yes, I had the basic FEMA certifications, the NIMS training, and then also I became certified as a FEMA certified safety officer, and that was for the urban search and rescue team. Illinois has a team, and I was part of that as well, which I was deployed to Katrina for that.
And did you actually go down to New Orleans for Katrina?
Yes, it was a 2-week deployment. We had, I believe, the first deployment was 100-piece apparatus and maybe 1,000 firefighters. I could be wrong, or that was 2 deployments. But we stayed for 2 weeks. I remember getting there, and it was very nasty, and my wife called me on the phone, and she was all upset the dishwasher broke. But I'm looking at water at top of roofs. It's like,
and the Superdome. Did you do the search and rescue job there? Is that what you were tasked to?
the state of Illinois went down there for humanitarian services to help out New Orleans Fire Department.
Mm-hmm.
All their fire departments were non-functional at the time, so we helped get them functional. And then we also had different teams, hazmat teams, firefighting. So yes, I was fortunate to be able to join up with FDNY from New York and fight fires. And then next day you might be doing decon, for hazmat, things like that.
Sure.
And then we also did humanitarian. We tried to get the firefighter and police officers' homes back in operation for them to come back and live.
So in 2001, you were promoted to deputy fire chief. Is that right?
Prior to that, I was a lieutenant,
Mm-hmm.
1998 to 2001. So on the shift, there was a captain and lieutenant. There'd be one officer on the truck company, one on the engine company.
What did a lieutenant do?
Dealt with a lot of problems. No, no, it was a great job. You overseeing your crew. Like I said, you could have been on the truck company or the engine, and you manage a small crew when you go to a fire.
All right. And so did you in that same period of time, 2001, become involved in 9/11?
We did go to 9/11. At first, we were going to be deployed immediately. We had to run home, get clothes. I signed a bunch of checks. I was raising my daughter on my own, my oldest daughter at the time. So I went to her school to say goodbye to her. And then, like I said, I filled out a bunch of checks because I didn't know when I was going to come home. We went for a briefing near O'Hare Airport, and at that time they were worried the potential of Chicago getting hit. So
Needed you back home?
yes. So several weeks after that, we started sending crews to New York, and that was more for humanitarian services as well. So yeah, we went to all the memorials and things like that.
So then from lieutenant, you became deputy fire chief, is that right?
That was in 2001, yes.
All right. And did you ever do anything in addition to going to 911 in terms of raising money for 9/11 firefighters and police officers?
Judge, object to the relevance.
We were in front of a rescue company, and there was a woman walking back and forth, and I kind of stuck my foot in my mouth. I asked her if she was waiting for somebody, and she stated her husband died. She started talking about the kids, how the kids are not being able to handle it. They're pulling their eyelashes out and that.
Judge,
And at that point,
relevance to the narrative.
It goes to something right now.
Let's get there, because this really is borderline.
I understand.
at that point, I felt the kids were not being taken care of. So I ended up going back to Illinois. I designed license plates for the state to raise money. So I made one for New York, and we went back with lots of money and called it Dad for a Day and made sure that we took care of the kids.
So tell the jury a little bit then about how old you were when you met Beata.
How
No,
old was
expect
I?
that. Before we get into that, when did you leave the fire department to move down here?
I left in 2014. That was the summer, right before the children would start school here.
And then, so you retired in 2014?
Yes, after 28 and a half years.
And so what brought you to Florida?
The weather, to be able to be outside with the kids, do more. My wife and I, we do scuba diving. We traveled all over for that. And we just thought it'd be a great place to come. She was able to
Well, let's talk about that a little bit. Do you remember meeting Beata?
I do. Like I stated, I raised my daughter on my own, my oldest daughter. My neighbors asked me to go out to dinner with them, and I was cutting the grass, and I told them no, and then they finally talked me into it. We're having dinner, and in walked this girl, and that was it. I knew she was it.
I take it you were introduced.
Yes, one of the firefighters' wives is also a nurse, and they came in for it was like a drug rep, pharmaceutical rep. They had a back room, and they were doing a little talk on that.
Sure. And so how long was it before you were married?
And after that, it was planning on having a child.
Okay. And did you have any hobbies or things at this point in common you like to do?
I made wine, so she kind of liked that as well because she enjoyed her wine.
What was that?
The wine?
Oh, making the wine.
The wine,
We'll get
yes.
to the wine in a moment.
Yeah, and then the scuba diving. We
Oh.
went all over scuba diving.
And I think we have a photograph with the court's permission, 2528-1. That would not be it.
That's not an evidence, Judge.
It's 2-28-21. Remember this trip?
I do.
Where was this?
I believe that was Belize.
Did you take just that one trip, or did you have other scuba trips?
We did several. Belize, Honduras, Mexico.
Was she certified?
Yes, she was an advanced diver.
And how were you at that time?
Just basic.
Okay. And did you enjoy these times with your wife?
This was a great time. I really enjoyed it. Like I said, I was raising my oldest daughter on my own. It's been a while since I had a relationship, and I knew she was the person to be with.
Okay. And we do have one wedding photo at 2528-14. We can get that relatively quickly. Where were y'all married?
We had a cruise ship. We went on a cruise and we ended up getting married in Montego Bay, Jamaica. And then the family wasn't happy we did that, so we had to have another wedding afterwards.
2.
Yes.
So tell us a little bit about Beata. I want to know what kind of person she was.
Beata, at that time she was working for Loyola University Medical Center. She was working in the cath lab. She was extremely dedicated to her job there. Loyola is a very big hospital. It's probably on a mile-long property. It's huge.
What did her job entail?
She worked within the cath lab.
Catheters?
Yes.
Did she work at that job the entire time you were in Chicago?
After Maya was born, or around that time, she worked for Walgreens, and it's basically the same thing as with CVS, doing the infusion treatments.
Now, was Beata a kind of a retiring type, or was she more outgoing? How would you describe the personality there?
Beata was always on her feet, always looking to do better, not only for her, but everybody else around her.
An overachiever a bit?
By far.
All right.
Try to keep up with her. It's impossible.
And she was originally from where?
I'm going to say it wrong, but Stola Wola, Poland.
Okay.
Yeah, she came over at the age of 16, I believe.
And did that, from what you saw, influence her insofar as the way she dealt with things? The fact that she had come over prior to Poland becoming free?
I know she told stories how rough it was in Poland. You don't go to Walmart and buy a pillow. You have to make your own pillow, pull the goose feathers out and make your own. Same with groceries, things like that. A lot of it was farming, and so it's a lot rougher. When she came here, she came without speaking English. She learned, and she started out in a high school, I believe, in Chicago, and it was difficult for her. But she's very determined, and after high school, she went to college. Her professor said she's not going to make it, and she ended up being the first in her class. She did learn. She was determined.
Do you know what her diploma was? Her degree is?
She did have an associate's, Moraine Valley, I believe it was, and then a bachelor's, and that was, now I'm going to go, Lewis University. That's in Aurora, Rockford. I could be wrong.
And was her income helpful to the family?
By far, yes. And she, after I retired, she carried the health insurance.
And I assume that was a fairly big help.
Yes.
So now, were you Roman Catholic when you met her?
I was not, but I did.
So was she close with, say, the parish priests, people like that?
Yes.
Stayed involved in the church?
Yes, she stayed involved. We attended, picnics, things like that they had.
Right. So the jury would probably like to know how Beata was if there was a dispute with an outside person, in this case, these doctors, but just generally, what was she like? Was it hard to get it out of her, or was she direct? What was she?
Beata was unique. when she's right, she's going to prove she's right, and she is right. A lot of times, we had differences, and I found out I was wrong. I mean, not just saying that.
A lot of husbands find that out regularly.
Yeah, she stands up. If she feels she's right, she's gonna stick to her guns on it.
Right. And do you think that from what you saw, her background in Poland made her more direct than the American way?
I believe so. Yes.
Can you give us any examples where she would, people would wonder, like, is she mad or angry, but she's actually just being Polish American?
Yeah, that's the hardest thing. When I first started out dating her, they say things different, and sometimes they're more blunt than we are. Mm-hmm. After time, I learned that she's not trying to be rude, things like that, but it does come out differently. Yes.
And did there come a time that you had a child?
We did. We had difficulty. We did the in vitro, mm-hmm. and it took some time, but then we ended up having little Maya. And when she was pregnant, that's when I was deployed to Katrina. So.
I'm sure she appreciated that, you being gone for the first.
I think she appreciated dishwasher being fixed after.
All right. So Maya then was from an in vitro infusion?
Yes.
And was that an expensive event to do?
It took some time, expense. I honestly don't recall what it cost, but
it takes some effort?
It took some effort, yes.
And so did Beata express a need or a want to have children with you?
She wanted a child very bad. And before I even left to Katrina, that room was decorated. I bet you every shelf in that closet had baby clothes to whatever.
And so then there come a time when you had a second child.
Yeah, Kyle was a stroke of luck. He just came out of nowhere. I remember walking into the house. Beata was at the little table in the kitchen crying and laughing at the same time. I go, "What's wrong?" She goes, "You don't want to know." And I said, "You lost your job." She goes, "Worse." And she goes, "I'm pregnant." So, but we got Kyle.
Now, was there something that might indicate to the jury Beata's determination in terms of having Kyle?
Well, Kyle, after he was born in Elmhurst Hospital, which was in our town that we lived in. He was born with petechiae. He had little dots all over him, and the doctor seemed very concerned. And after a little bit of time, they stated that he needed to be transported to Loyola University Medical Center to the PICU. He had a condition called neonatal thrombocytopenia, common spelling, I guess. It's no platelets in the blood. So he had to be transferred to Loyola, and mom could not be transferred because she's no longer, she's not a patient at Loyola. She just delivered a baby, and she checked herself out of the hospital to be with her child.
How long was this after giving birth that she checked herself out?
I'm guessing less than 2 hours.
And so what did she do then?
She went to Loyola with Kyle and us.
Did she do anything to help?
She laid on the couch at first, and while Kyle was being assessed and treated. They originally gave Kyle donor platelets, which he would take them for some time, and then his body would reject them. It was like washing out a soapy bottle. It's going to take time. But the donor platelets weren't taking, and he needed mom's, and mom just gave birth. So that was an issue, and finally there was an agreement that she could give the platelets, but unfortunately that wasn't at Loyola. We had to go up in the northern suburbs, I believe Northbrook, which was about an hour away, and then she would get the platelets taken out of her, and they had to radiate them and then bring them back to Loyola to Kyle.
And this was all within a few days of his birth.
Few days, and this went quite a while because, like I said, it takes a while for him to accept them. He did accept them, and then he was released. And he came home, and Beata knew something wasn't right, and she called the hospital, and they admitted they read the platelet counts wrong, and he had to go back. So he was admitted for about a month in the whole span.
Was Beata protective over her children?
Extremely. That was her life, was those two children there, including my oldest daughter.
Now, was she involved in any activities for Maya and Kyle?
Beata would work out every single day. I mean, and then we started dance classes, things like that, before the wedding.
Did Maya start, put it this way, were there skill sets, sports and things that Beata knew of or had done that she was teaching to the children?
Number one would have been the Polish language. And then they went to Polish school. They learned, the history along with, I don't think they did handwriting or anything, but they did speak. They learned how to speak Polish.
Are you still able to, or is everybody able to speak Polish still? Or is it?
I believe Kyle lost it. Maya still knows quite a bit, not as good as she was.
Mm-hmm. And what about Maya beginning, and Kyle, in different sports and activities? Was Beata supportive of that?
Very supportive. They both, number one, they both went to school before the age of 5. They went to the public school for a special program at the age of 3. And that's probably why they're so smart. But
and so
they did piano at the age of 3. They were involved in gymnastics. I believe she was in ballet as well. But they were always active.
So ballet, gymnastics, and piano. And would Beata take them to these different activities?
Yes, and I completely forgot about another one. It was ice skating.
That's right. I understand Maya tried ice skating once she was able to get out of the wheelchair. Did not last very long.
No, I think it was just too much. She was ice skating and working out. She wanted to go back to ice skating because her mother did skating as well. I think she just wanted to continue it for her mom.
Did you have a hard time with it after a while in terms of the emotional impact?
Yes, there was some emotional issues with that.
This was an activity she did with her mom, so.
That's correct.
Now, there came a time then when Maya got sick. Is that right?
Yes.
The jury's heard a little bit about this, but why don't you tell them from your perspective what happened that weekend of July 3rd, 4th? Yeah, and if we could, Judge, we'd like to publish our timeline that as a demonstrative aid. We provided it to council. You have it.
Yeah, that's good.
No, just publish it. We're not entering it into evidence. Is there an objection?
It's the same. Yeah, that's fine. That's fine. Don't do it.
Now, before July 3rd, 4th, had Maya already been to Johns Hopkins once on June 16th, 2015?
Yes, originally she went to Doctor's Hospital for asthma complications. And I believe doctors do not hold pediatrics overnight. I could be wrong on that. So they were going to airlift her to Johns Hopkins All Children's Hospital. The weather was bad that day, so they just did a ground transport.
That may have been after July 4th. I was looking at the June 2015?
This
before-
was June 16th.
Okay, that was the June 16th?
Yes.
All right, my mistake. All right, and this was for, again, her asthma?
Severe cough, bronchial spasms.
Now, generally speaking, as the kids were growing up, were they healthy?
They were healthy. Maya has seasonal allergies. Most of us do, but she always seemed the allergies bothered her a little more. She would have the little, around the eyes and that. She did have asthma. She was diagnosed, I believe, at Lurie's Children's. It was a satellite in Westchester, Illinois, but didn't have too many complications. She did have croup here and there.
Mm-hmm.
A lot of times I would put her in the car to take her to ER, and up north, the cold weather helps the croup. So by the time I got there, it would be gone. But
Did that keep Maya down from any of her activities? Or was it?
at that time, no. She was gymnastics, ice skating, everything like that. But, she did have allergies.
Other than the allergies and asthma, was it just typical childhood illnesses?
And not much other than that.
And Kyle as well?
Kyle, healthy as well. He has seasonal allergies. I don't think it bothers him as much.
Mm-hmm. All right. And so now let's get to that weekend of July 3rd and 4th. And I believe the jury's seen some photographs and maybe a movie of that. But can you tell the jury the first time you thought or saw or heard that Maya was in trouble?
Well, she was having, in between that June 16th and up to July 4th, she was having quite a bit of asthma problems or a weird cough, which wasn't the cough we used to hear. So it was kind of alarming to us. But in between that time, she did visit different ERs for that condition.
All right. So by the time of July 4th weekend, she had been in one outpatient and one inpatient at Johns Hopkins?
Yes.
All right, so tell the jury what happened then on that July 3rd, July 4th weekend.
So we have a neighborhood, as you've seen, I think the picture, we have a neighborhood bike parade for the children, and then also a party afterwards. She was riding her bike in the morning, no problems whatsoever. And then at that, later that evening, she was having a problem with asthma. There was some sparklers the kids were playing with. We cannot pinpoint if that's what triggered it or not, but so Beata took her to the emergency room, to Sarasota Memorial.
All right. This was on what day?
That was July 4th, I believe.
Okay. Were you there then for the episode with her on the floor that's been testified to, the scream?
Yeah, unfortunately, we were the ones hosting the party
Right.
that year. So, yeah, everything became chaotic, and seeing her in that pain, we knew something wasn't right. It wasn't something we seen before. She was in more pain than that.
Well, were you present or not present for the sound that witnesses have testified to?
At a certain point I was, but I don't recall being in there when it first happened. I may have been outside at first and then was notified and came in.
Well, describe Maya's condition after this. Was she calm, cool, collected, or was she acting out? What was going on?
There was, like I said, it was a weird cough, and she was also, I believe there was chest pain with it.
And so you then took her to the emergency room?
Beata took her to the emergency room, and then I was home trying to get everything shut down or taken care of.
Okay. And you were worried at that time, were you?
Yes, I was worried every time she went in.
All right. So on July 11th, 2015, was Maya admitted to Johns Hopkins? Or July 6th?
July 6th, yes.
Through the 11th. All right.
Yeah, this was a admission July 6th to July 11th.
Okay. And over that period of time, did anyone at Johns Hopkins ever raise any issues or concerns about your relationship to Maya or Kyle, like that they were troubled?
No, not at all.
Did anyone ever doubt either Maya or your Beata's description of what was happening with her?
No.
So then Maya came out, and then there was a second admission on July 15th. Tell us how that happened.
July 17th.
17th.
That was my birthday.
Okay. Happy birthday. And
Yeah.
what happened, if anything?
She was admitted again. That Johns Hopkins All Children's Hospital. That was for difficulty breathing, I believe. And then she also had acute pain all over, which was something that we didn't experience before. I believe she was diagnosed with myopathy or due to the steroids.
Okay. Let's, if we can, it's in evidence as 1008-002. If we could. So what was the diagnosis here, I believe, as you just testified to?
Yeah, generalized pain,
Mm-hmm.
myopathy, weakness, or fatigue.
Okay, and it's got the names of some of the doctors up there. And from your memory, did you get along? You and Beata get along well with the doctors there?
I don't recall any problems.
Okay. And then let me show you Joint Exhibit 1008-0003. Again, this is in evidence as part of the records. And I'll direct you then to the second paragraph there where it says presented as soon as it comes up. Okay, so if you would, take a look at this. And if it refreshes your recollection, can you tell the jury what happened then while she was in Johns Hopkins? This 17th, second paragraph.
Second paragraph. She had acute increased pain, everywhere,
Mm-hmm.
and mainly muscles.
Okay.
Over the past 6 days since discharge has been stable. Pain and weakness have been constant.
Well, it says, but had been able to sit in a wheelchair and something there. Before this time, was she even having difficulty sitting in the wheelchair?
She had one time she came back from the emergency room, she had weakness where Beata had to carry her into the home. But the next day she was able to get up,
Okay.
I believe.
Well, did she end up leaving Johns Hopkins on this admission in the wheelchair?
I'm sorry, there's so many roller coaster rides we were on here.
That's all right.
I believe she was in a wheelchair at this time.
Okay. So let me also ask a little bit about the consultations while you were there. On Joint Exhibit 1008-0004. Okay, and if you look at the first full paragraph about 5 lines down. All right, and so tell us what's going on here. Excuse me.
She's in pain.
Well, what are they prescribing for that pain?
I'm gonna really do
Did
bad
they-
with these names.
Let me ask you.
Toradol,
Right.
yeah, oxycodone,
Mm-hmm.
Valium.
Right. And was this able to control the pain, or was she
Now
still in
then,
pain?
as you go right after that,
Judge objects, it's lack of foundation and predicate overall.
did this control her pain, or was she still in pain?
No, if you continue to read right after the highlighted area, over the course of her stay, it was increased. So obviously, no. And I remember something distinctly from when she was being discharged, or right prior to discharge. There was a doctor wheeling her little computer and having, I guess, students following her. And she came up to me, and she honestly, she put her arms up in the air. She goes, "I don't know what's wrong with her, but we could give her pain medication." And I said, "No, that's not acceptable." And that's when we decided to go somewhere else.
All right. So it says the patient was discharged PO with Valium, oxycodone, Tylenol, ibuprofen for pain control after extended discussion with the parents and previous outpatient provider in Chicago.
Sustained.
Who was the previous outpatient provider in Chicago?
The outpatient previous
Well,
hospital in Chicago.
okay.
That's where we grew up, so we were not familiar with this area.
Okay. Now, if you look at 1008-006, I want you to just count up the number of medications that she was prescribed there.
Objection, again, record speaks for itself. Also,
Doesn't say the number.
Overruled.
Under prescriptions?
Yep.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 on this page.
Okay.
I could be wrong.
All right. And so why Lurie's? Why did you want to go back to Lurie's?
Like I stated, we're newbies here in Florida. We went to Johns Hopkins All Children's Hospital. The name, it's a big name hospital. We thought we would get the answers there. Unfortunately, we did not. So we went back. Maya and Beata, they flew back to Chicago to go to Chicago Larry's.
Now, before anybody said, we don't know what this is, did you ever hear anyone questioning Maya's pain or your concerns over it? What was this? Did anyone at Johns Hopkins, up to the point of Lurie's, ever mention anything about a problem with either your treatment of Maya or your relationship with Maya?
No, there was nothing brought up about relationship. We were concerned because we never seen a lot of these things that were going on, and it seemed like it was one thing after another, blurred vision or sensitivity to light, things like that. But when I got the arms up in the air and stating that we don't know what it is, but we could give pain medication, that's not the answer we wanted.
All right. And so went up to Lurie's.
Beata and Maya flew there. I called ahead of time, and Chicago Fire Department, along with our fire department, met them at the airplane and took her off the plane. They took her directly into Chicago. A fire chief waited for their luggage and brought it right after. But she went to Chicago Larry's.
Was this an inpatient?
I believe so, yes.
And approximately how long was she there?
I think it was a short visit, I know that.
A week or so?
21st through the 24th.
There you go. And over the course of this, did Lurie's come to any conclusions beyond this muscle pain?
It's such a short visit. I honestly do not know if they came up with a conclusion of what it was, but they recommended to go back to an inpatient rehab for Maya.
So no solutions at this point?
No, we're still undetermined of what's wrong with her.
Now, had Maya started rehab, any kind of rehab by this point?
She did go through, I don't know if it was at that time, if she was going to All Children's Satellite in Sarasota. I could be wrong. It could be after. Honestly, there's just so much of this.
I understand. All right. But in any event, what, if any, diagnoses can you recall that Lourdes came up with?
They did not diagnose.
Did they ever talk to you about any psychosocial problems while you were there?
I was not there. So,
Okay.
yeah.
With Beata, this your knowledge?
Beata was there. I don't know if that's where this conversion disorder or fictitious disorder came from. I honestly don't know.
Well, did any information come to you from any source to indicate that Lourdes had reached out and tried to explain why they went from not knowing what it is to allegations of conversion?
I honestly don't know.
Okay, so let's continue on then. After that week or so in Lurie's, and I guess she had been seeing Dr. Wassenauer. Who is he?
Dr. Wasner is our primary care physician. He's in Osprey, Florida.
Okay, can we move the slide to the next one, I believe?
I couldn't go to the October admission.
Okay, sorry, got to go to the October admission on the timeline. All right. So
There was, sorry to interrupt you, but there was also a visit with Dr. Nathan Tang. He was an allergist. That
Where?
was in St. Pete.
And what
And
were
that
you
was
looking
July 29th.
And what were you looking for there?
That was in reference to the asthma.
Were you looking for different doctors that were on your health insurance plan?
A lot of it, yes, that was a big factor as well.
So on October 20th, 2015, was there another ER visit?
October 2015?
Yes, October 20th, 2015 there, the end of this.
Yes, I do not have that listed on mine, but
October 2015.
Okay.
There, it's the
Yeah.
last one on the top.
Your Honor, we object if we can approach.
Okay.
Okay, I'd like you to look down under diagnoses. What's under the discharge diagnosis? What are they saying it was?
abdominal pain,
Yes, and under that?
reflex sympathetic dystrophy,
What
and
is that
constipation. I'm sorry.
Mhm. And what is RSD in terms of CRPS?
That's the old name. Now it's CRPS, chronic regional pain syndrome.
So effectively here on October 21st, 2015, Johns Hopkins is diagnosing reflex sympathetic dystrophy.
Objection, lack of foundation, mistakes passed.
It's right here.
Sustained, you gotta do the foundation.
I'm not sure for what he's talking about. Which part?
I'm happy to say more if you'd like.
I'll continue. Let's take a look at Joint Exhibit 1014-0003. And again, for the record, this is a Johns Hopkins discharge summary of admission date, October 20th, discharge date, October 23rd. And is this the narrative, to the best of your knowledge, from that stay for your daughter?
Objection, lack of foundation.
What's the
Overruled.
evidence?
You can answer, sir.
Yes, thank you. I'm sorry.
All right, if we look at the top line then, does it again reiterate what their diagnosis was here?
Same objection, lack of foundation.
Overruled.
Yes, it does. Reflex sympathetic dystrophy syndrome.
And here did she have some abdominal pain?
Yes.
So in terms of new symptoms, on this October 7th, 2016, the next year, did she have abdominal pain at that time as well? The one we're about here.
The first admission?
Yeah, the one on October 7th that we're about here.
Oh, October 7th, yes.
All right. And so then it says there about 3/4 of the way down, if you'll note, because of RSD symptoms, she has a lot of opiate treatments, such that Maya takes more oxycodone than baseline. Mom ensures that she has her on Marilax. So from your knowledge, were you familiar with the different medications that your daughter was taking?
Check to the leading line.
Overall. You can answer.
She was on quite a bit of medications.
Were those prescribed primarily by Johns Hopkins All Children's Hospital?
Actually, lack of foundation.
Overall.
Most of them, yes.
And so if we're talking about whether Maya then started to go through treatment regimens with opiates at this time?
She was.
All right. Now, it says on the bottom, neurological, unable to fully examine lower extremity at any time during hospitalization due to patient reluctance and complaints of hypersensitivity. I lightly touched her right knee one morning and she nearly jumped off the bed and began shaking and crying. First, let me ask you, over this time, have you become familiar with what the symptoms of CRPS are?
We just prior to this, correct, is when we went to Dr. Kirkpatrick.
What I'm saying is now, are you?
Yeah. Oh, yes. Yes.
And what is this called when you just jump off the bed or you jump out of the chair when there's a light touch?
That I believe is called allodynia.
And what other symptoms did she have at this point? Did she have blurred vision?
Hypersensitivity, light touch her right knee in the morning. There he jumped out of bed, began shaking and crying.
From the last visit, did it, if you recall, did it state that she had blurred vision? I think you just testified
I
to
believe so, yes. Yeah.
Okay, so we've got extreme pain, blurred vision, and we have what did appear to you, now knowing what you know, that the allodynia was appearing?
Yes.
Okay. At this point, had her legs, ankles started to turn in, or were they still straight?
I believe at that time they might have been dropping down.
Kind of like that?
Yes.
Okay. All right. But then says, I found this unusual. She's capable of moving her legs around under numerous heavy blankets without experiencing pain. So tell the jury from what you know about allodynia, why that is significant or not significant.
Well, there's days that if you start approaching her, she'll retract from you. And then there's days that it doesn't really bother her as much. But the allodynia, it was very difficult. I remember Kyle trying to help her and her legs would just start to shake. I mean, it was bad.
Okay. Now, prior to this date, had you tried physical therapy?
And then from there, they worked on the lower extremities.
And the jury's heard from the physical therapist there, but did you visit her there?
I was there as much as I could be.
And did you observe your daughter there?
I did.
And was she in pain the times that you saw her?
She was in pain, and then they made these boots for her to try to straighten her feet out. And when those were placed on her feet, it was extremely painful.
What was it like watching her?
There was a doctor there, Dr. Kornberg. He said if she doesn't straighten her feet out, he's going to break them and straighten them out himself. I'll never forget that when he said that.
Well, did you take that in jest, or did you take that as serious?
That was, you don't joke like that. Not to a person in pain like that in the first place.
Well, did they give you any additional alternatives other than, okay, we tried PT and that's not working? They give you any other things to do?
We agreed to try to PT, and
more PT.
Yeah, we were there for a month.
And was it successful or not successful?
Partially.
Partially. Did it help
The
her
upper,
a little bit?
the upper extremities, yes.
So it did help on the upper
Yes.
extremities. And did it help on the lower extremities?
No, unfortunately, it was getting worse.
All right. And so I can show this if we need to, but it's at, did I show 10140008?
Not yet.
Huh?
Not yet.
All right, let's show that. Okay. So in this last visit from Johns Hopkins, skipping ahead, it was, if you count up here on the 2 pages, does it indicate that there were 24 separate, distinct medications or vitamin remedies that were prescribed for Maya when she left?
Now I see 24, yes.
And those included oxycodone. Is it number 19?
Yes.
And 11 diazepam, which
Yes.
is Valium, right?
Hmm.
And baclofen, what is that? Is that a muscle relaxant?
I honestly couldn't tell you.
Okay. But in any event, were they continuing now on the opiate physical therapy train in terms of treating your daughter?
Yes.
Object to the foundation speculation.
Overruled.
All right. So now you've been to how many hospitals, including Johns Hopkins, to try to get this diagnosed?
Quite a bit.
And had you seen some outpatient providers here and there?
Yes.
Did anybody have any answers for you as to why your daughter had these reactions, different reactions than what the doctors expected? Up until that point, did any doctors?
What was the last date on that? I'm sorry.
I thought that was 10/20 to 10/23.
Yeah.
So
So,
October 20th to 21st.
All right, 20th to
yeah,
21st.
so prior to that, we did see Dr. Kirkpatrick,
Okay,
and
so let's talk a little bit about that. So how did you find Dr. Kirkpatrick?
Beata was at a patient's home doing a treatment. The gentleman lived in Naples, Florida.
Okay.
So she would be given the treatment, and she received a phone call from Tampa
Object to
General.
hearsay, Your Honor.
Madam Court Reporter, can I have the specific question back?
Question, so let's talk a little bit about that. So how did you find Dr. Kirkpatrick?
Overruled.
You can answer.
So while she was there treating a patient, she received a call from Tampa General Hospital. Bonnie Rice was the nurse practitioner. And she basically told Beata that Maya has conversion disorder, fictitious disorder. I don't know which one. Beata was not pleased to hear that. I'm sure she got a little vocal on the phone. The patient overheard it. So after she hung up with the nurse practitioner, the gentleman said, "It sounds like your daughter has CRPS." And she's like, "What is CRPS?" She did not know. She came home, she did research, and then she did find Dr. Hannah. This patient that she was taking care of, his daughter was in Mexico with CRPS getting treated.
So how did you get to Dr. Kirkpatrick before Dr. Hannah? Which came first?
Dr. Kirkpatrick was first. She did research. She did set up an appointment to have Maya evaluated. I went with her. That was in Tampa. He did a pretty thorough evaluation.
Was that videotaped?
Yes, it was.
Yeah, regardless of videotape, can you give an idea to the jury about how far your daughter at that point could lift her arm?
She did not have much motion in her arms to raise them up high without being in pain. She did have more dystonia. That's the turning of the feet. There was allodynia. That's the sensitivity, the touching. She had some other weird things going on, temperature differences. I had no clue that, all this was going, some of the nails, some of the hair, I guess the growth of the hair was different. But he was asking questions, and it's like, yeah, it's the first time we're hearing somebody ask us questions, and it seemed like he was on to something.
It made sense to you?
Yes. We were somewhat relieved to get a diagnosis, but also extremely sad. It's a diagnosis that we have to live with the rest of our life.
So he informed you of the basics of CRPS?
Yes.
All right. And so at first then, what did Dr. Kirkpatrick prescribe? Did he go straight to ketamine, or did he go to another treatment first?
I think there was some exercising. We did pool therapy. Right away when he recommended the pool therapy, we do have a pool at home. It is heated by the solar panels on the roof, but we added extra panels to make sure that it had to be at a certain temperature range. It's like a bathtub, basically.
Is this known as warm water therapy?
Yes.
And so he wanted more warm water therapy as PT?
Yes.
So
And only he limited it to a certain amount of time, not to exceed a certain amount of time each day.
So he did not go immediately to ketamine. He tried what you'd had before, or had you had warm water therapy before?
Judge to believe, Your Honor.
I don't believe we had.
Hang on, I'll rephrase.
Sorry.
Had you had warm water therapy prescribed for you before this?
I don't believe at that time, no.
And was this his first treatment before he went to medications?
I believe that's the first treatment.
All right. And so by this point, it doesn't need to be exactly accurate, but can you tell me about how many different weeks, how many times your daughter had been to physical therapy for this problem by this point?
Physical therapy at that time, we had to be careful. We couldn't, overdo it. We had to do it, slowly. And but I honestly do not remember the amount of time.
You'd been at Tampa General for 4 weeks?
That was a whole month, yes.
Whole month. And you had had some PT at Johns Hopkins, different points?
Yes, that was at the satellite office in Sarasota, I think on Clark. I could be wrong.
And you'd been to Lurie's, and they had PT as part of it, did they?
Lurie's, I couldn't answer to that. I do not recall that.
So at least 4 or 5
Yes.
weeks of PT.
And
was this every night at this point?
it was mostly throughout the day and night. After hearing that, Bonnie Rice saying it's conversion disorder, this child was screaming and crying. If she took a shower, the droplets of the water would make her scream. You put a sheet over her legs, she would scream. She had to be assisted on the toilet, and she would scream. She'd look out the window, see her friends playing, and you knew that she's not faking this. Did I ever think she was faking at first? It was like a light switch where, all of a sudden everything changed. It's like, it is just so unbelievable that something could happen that quick.
Did they ever figure out if it was a ankle sprain from gymnastics or the asthma that was a precipitating event?
We never determined what it was, but prior to this, I believe it was April, May, she was in gymnastics at the YMCA in Venice.
Mm-hmm.
She did have a right ankle injury. It was like a sprain or strain. They called and asked if we wanted to be, have it followed up by a doctor. They were very good about it. They were concerned about her. But in time, it went away. But we cannot pinpoint that injury on it.
Where was everybody sleeping in this period of time from once it got worse after July 4th of 2015 up to this point, the early fall of 2015?
Honestly, it didn't matter where you're sleeping in the house.
Mm-hmm.
You could hear her. We took turns taking care of her. Beata was still working. She's the one that maintained our health care insurance, so we had to switch off. It was very difficult, extremely difficult. Poor Kyle's close to her room. I'm sure it interfered with his sleep as well, and he's going to school.
All right. And so you went to Dr. Kirkpatrick, and there was, he prescribed some physical therapy, again, this time water. What was the next step? That's right. Before that, can you tell the jury whether Maya, by temperament, was a child that would make a mountain out of a molehill, scream a lot louder for just a little thing, or
No.
was she more on the stoic side?
Absolutely not. They're just like me. I could tolerate pain, but when I had a kidney stone, that's what kicked my butt, and I'm sure that's what she felt like, if not worse,
And from just her facial expression, can you always tell she's in pain, or does she hide it well?
she would try to hide it, and I don't know if Dr. Chopra is the one that mentioned it, but there's ups and downs with that, where it could be extreme for some time, and then there's times where it's not as severe. You could see her face. You knew she had pain.
Are there days when she doesn't look like she's having pain, but she is?
Yes, and in fact, we were in church several times where we had to leave. It bothered her that much.
Do you have any explanation for why somebody would put down in the Tampa General documents or Lori's documents this idea that it was all in her head when you had all of these instances you brought to their attention?
Objection calls for speculation.
Sustained.
What, if any, mention did they make to you up until Bonnie Rice that you should consider that Maya was making this up? Or did they not talk to you?
Objection to the lack of foundation in the statement.
Overruled. You can answer that.
I'm sorry, can you repeat that?
Sure. Other than Bonnie Rice calling you and telling you, did any doctor there before Dr. Kirkpatrick in this period ever sit you and be out of down and explain why they thought it, or was this just a diagnosis you discovered?
Nobody ever sat us down.
Did you sense frustration at all, or whatever emotion, from the doctor's inability to identify what was wrong with Maya?
Objection calls for speculation.
Sustained.
What, if any, reactions did you note if you brought up the pain your daughter was having with the different doctors and nurses?
Brought it up, but they had no answers.
And through looking at their face and their mannerisms, were they frustrated? Did they appear frustrated with this?
Objection calls for speculation.
Overruled on that one.
Like I said before, the doctor holding her hands up and saying, "We don't know what it is, but we could give pain medication."
Was that concerning to you?
It
and
was
PR?
very concerning, and that's why we left.
Did you
We know
want
our
your
daughter.
Did you want your daughter on opioids, or did you not want your daughter
No,
on?
we want whatever's wrong with her taken care of correctly.
All right, then. So I want you to then, considering the PT and opiate therapy to this point, I want you to explain to the jury when and how you learned about ketamine.
That was with the consultation with Dr. Kirkpatrick, Anthony Kirkpatrick in Tampa.
And if you recall, what did he tell you about that?
He explained the procedure. He talked about, it's been around for quite a long time. He mentioned that it's used for many things. It's safe. There is the side effect when they're coming out of it is a hallucination for a short period of time, but then they come, everything's back to normal.
Did he explain that that was generally controlled by another med like Precedex or others?
Objection to leading.
Overruled on that one.
Did he explain at that time that hallucinations could be suppressed or controlled with the use of other medications?
I don't recall, to be honest with you.
We'll ask
He
Dr.
did.
Kirkpatrick.
He did give us a website to look at also and then other literature. Once again, I wouldn't expect Beata to go put out a house fire, and I don't want to be a nurse, so
Right.
that was in her part.
So how is this affecting Beata now before Dr. Kirkpatrick? Was there what was her sense about it?
Beata was looking for the answer. She knew there was nothing wrong with Maya's head. Your child. The child's not going to all of a sudden just decide I'm going to fake this and not play with my friends outside and, just sit around and watch your body deteriorate. Along with that, you don't put lesions on your body by yourself as well.
When do those start?
I don't recall exactly when, but that was another sign of the CRPS.
Mr. Anderson, in the next 5 to 10 minutes, can you find us a good landing spot for a break?
Yes, sir. I'm just going to finish up with Dr. K and we'll be done.
5 to 10 minutes.
Dr. K?
Dr. Kirkpatrick.
Oh, I thought you meant me.
I'll refer to you as doctor from here on out. All right. So what we'd like to know now is, did Beata start asking questions of Dr. Kirkpatrick of the specifics about the safety of this before the whole procedure, before she gave her blessings to it?
Beata's very thorough. She'll ask many, many questions, and she won't stay there. She'll research more, and which she did. She, I believe, asked about who's going to be in the room, who's going to be doing this, what if, a lot of questions. She's very concerned. It's not like, go ahead and do it. And, he's very knowledgeable. And that's the first person that we were able to get good answers and a good diagnosis.
And so did you press forward with a ketamine treatment?
Yes.
Tell us how that went.
Originally, he told us how it's going to be. She's going to get the treatment. She will hallucinate during that time. Sometimes some patient may do better than others.
Mm-hmm.
We did see some improvement, but unfortunately, it wasn't the lucky one to have better improvements.
Did the symptoms reduce in any way, or was this just...
Yes, they did, and I forgot how many treatments she had. I honestly don't remember, but it did help. And we did, you know what, it was, here we're on that roller coaster, and finally we're climbing up and feeling good. But then, unfortunately, at some time, we took that big dip again.
Right. And so after the series of infusions that she'd had with Dr. K, did he make further recommendations?
Yeah, there was still, we're doing PT as much as we could. But then at one point, he stated that, he had recommended that we go to Monterrey, Mexico to see Dr. Cantu. He does a procedure there.
And did he explain why?
The reasoning was, in the States, you're only allowed to do a certain level, and it's not FDA approved. And then
The procedure?
yes, so we had to go to Mexico. He did, in detail, once again, explain the process, the ups and downs with it, and we looked at, once again, Beata not saying, okay, let's go. It was research.
And
Unfortunately, during this whole time, Beata would be running around doing all this, doing her work, and also going home at night to late at night doing research.
and then in the evening with Maya,
Yes.
taking care of her. We can pause here if you'd like, Judge.
Okay, members of the jury, why don't we take an afternoon break? Let's try to keep this about 10 minutes. Let's try.
Had, let's bring up that timeline. Around this period of time, after Dr. Kirkpatrick had to start the ketamine infusions, did there come a time that you went into Johns Hopkins to have what's known as a PICC line installed?
That is correct.
And this was in the fall of 2016?
Yes, somewhere around there.
And tell the jury, best of your knowledge, what a PICC line is.
I don't know much of what the.
Was it a procedure?
Yes, it's a procedure. I believe it's a long. It goes into the vein or the artery. I honestly. I don't
Okay. And so did you have to check her in for this? Was she
Yes.
admitted?
Yes.
And do you know how long she was in?
No, I honestly do not.
And the medical records, you explained that the PICC line was for these ketamine infusions?
That is correct.
And did you explain in the history that this was due to CRPS? She was having ketamine infusions?
Yes, they would have received the whole history of why it was needed.
And did you, after that, or as a part of that, did anyone from Johns Hopkins come to you and challenge you about either the diagnosis of CRPS?
Object to the leading room.
Sustained.
What, if anything, did you hear from Johns Hopkins about protesting, saying she didn't have CRPS during this PICC line admission?
Nothing.
What, if anything, did they say about conversion disorder during the PICC line admission?
Nothing.
What, if anything, did they say about any issues that Maya, it may be all in her head during the PICC line procedure?
Nothing
Admission.
was mentioned.
Okay. And also during this period of time, did you have a chance to go in and see a pulmonologist at Johns Hopkins named Dr. Kreisman, Anthony Kreisman?
I did not. I believe Beata did.
And have you ever learned that in that the upcoming trip to Mexico was related to them?
Objection leading.
Overruled on that one.
Yes, it was for the upcoming, and she also had a consult at Eagle Wings as well.
I was just getting to that. Okay.
Sorry.
All right. No,
Didn't mean that.
absolutely. All right. So let's talk about Eagle Wings. You remember approximately the time you started? What is Eagle Wings so the jury knows?
Eagle Wings is a company in Venice. It's for counseling.
Therapists or psychologists? What was it?
I honestly do not know their titles,
Mhm.
but they were extremely helpful. And it wasn't just for Maya, it was for the whole family.
Okay.
We were all trying to cope with for counseling.
How was all of this